Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today we're announcing 11 additional deaths due to COVID-19, one from Interlake Eastern Health Region, one from Prairie Mountain Health Region, two from Southern Health, Santé Sud, 7 from Winnipeg Health Region. I'd like to extend my condolences to their families, to their friends, to their caregivers. Due to a data correction, one death has been removed. This was a male in his 30s from the Winnipeg Health Region that was announced on Sunday. So this individual did pass away. However, it was not from COVID-19 and therefore is removed from the COVID-19 data. Our current number of deaths due to COVID-19 is 783. The current 5-day test positivity rate is 9.9% provincially, 7.4% in Winnipeg. 111 new cases of the virus identified as of 9:30 a.m., taking our total number of confirmed cases in Manitoba to 27,740. As I'd indicated yesterday, the actions and hard work and sacrifices of Manitoba and Manitobans has continued to make a difference. Overall, our numbers are headed in a good direction, and this means we can start looking at what reopening might look like. We had great participation in the Engage MB survey, and wanted to share today about some of the reopening considerations we're having at this point. And so I think that certainly the overall theme is a cautious approach. We know that we can't get back to where we were in late October or November, and we know that the more interactions there are, the more chances of this virus being transmitted. So we have to have a very cautious approach. We don't want to go back and forth. We want to have a slow, cautious approach so we can continue reopening over time, not have to go back and close certain things again. And so we know Manitobans are eager, especially businesses, to reopen, and these restrictions have been difficult for probably most Manitobans. But we need to have that cautious approach. So we're really looking at 3 areas for this iteration: household limits, retail operations, as well as some healthcare services, hair salons and barbershops. And so these options are under consideration at this point. We haven't made final decisions. We'll be making those later this week after following some further even consultation. So regarding the household gathering limits, our current orders restrict visitors to private residences with some specific exemptions that enable trades and supports persons and limited visitors for people who live alone. Our new orders could expand that. We could increase, to increase those personal connections and well-being of Manitobans to 2 additional people within the household, family or friends, so 2 additional people outside the household to be able to visit. We could look at going back to the group size limit of 5 for outdoor visits at on people's property. And we are also considering increasing funeral limits from 5 to 10. Regarding the retail operations, our current orders allow establishments to be open 25% capacity with a maximum cap of 250 people. Stores are required only to sell the items that are on the essential list. So what we could look at is keeping the capacity limits the same, 25% capacity with a maximum capacity of 250, and then the elimination of the essential items list. So all retail stores would be able to open. They wouldn't have to worry about the essential items list, but would still have to have the capacity limits as well as all the requirements for physical distancing, etc. So non-regulated health and hair salons and barber shops. Currently, some of the non-regulated health services, hair salons, barber shops are currently closed. Our new orders could be expanded to allow non-regulated health services such as reflexologists to reopen. Again, with limitations on capacity and physical distancing and requiring keeping records of people who have attended for contact tracing purposes. And the same thing with barbershops and hairstylists, open up at 25% capacity with the physical distancing and collecting that information for contact tracing purposes. So given the high rates of cases in northern Manitoba currently, including many First Nations in the Northern Health region, and the need to protect many of those communities that are quite susceptible for large outbreaks. It is possible that any of these proposed changes would only apply to regions other than Northern Health. So it would apply to Winnipeg, to Southern Health Santé Sud, Interlake Eastern, and Prairie Mountain Health regions. So based what's currently on the table, we just outlined here, the input of Manitobans is again requested regarding these proposed changes, and these could come in effect as early as Friday. So you can provide that feedback again at engagemb.ca. We need to take this cautious approach. We know that Manitobans have always worked hard to reduce the transmission of this virus, but we know that the more interactions we have, we raise the risk. So we know that in October and November, every establishment that was open was doing their best to reduce transmission, had protocols in place, and yet we still saw a very bad trajectory of the virus. So we know that the more interactions we have, the more of the virus we will see. So we have to do this very cautiously, and we just don't really want to go backwards. We want to be able to progressively reopen this province without having to stop and reset. So we're going to take that cautious approach, taking advantage of the progress that we've all contributed to over these last many weeks, and we'll work together to continue that. So we can't open everything at once, so that's why we see a very limited opening now, and we'll continue to review these. We'll likely have these orders in effect for 3 weeks, and again, review. We'll review on our numbers and see if there is any more cautious reopening that we can do at that time. We always have to remember the fundamentals. Staying home when ill, even with mild symptoms. We've heard continuously from our public health nurses and contact tracers of people who had been out and about with COVID-19 because it was very mild symptoms. They felt it couldn't be COVID-19 because it was quite mild. But we know a certain amount of cases are mild. So we encourage all Manitobans, stay home if you're ill, go for testing, even if you're mildly ill, even if you're not sure. We have a lot of testing capacity, so we're encouraging Manitobans to utilize that, even if you're not sure about your symptoms. Staying home when you're ill, washing your hands, minding that physical distancing at all times. So we're going to focus on those fundamentals. We're going to protect ourselves, our loved ones, our co-workers, other Manitobans, and we're going to continue to make these sacrifices in the short term. But like I've said, there will be an end to this pandemic. And we just have to ensure we're reopening things in a very safe and cautious manner so that we can be ready for that end. So thanks to all Manitobans, and open up for some questions.
Thank you, Doctor. We are having some issues with our telephone service today, so I will read the questions from the reporters to you. Up first from the Winnipeg Sun, Scott's questions. Why not any restaurant changes? If you're going to allow retail to open up, what would be the risk there?
Yeah, it's the nature of the virus again. So in retail, we think it's still a cautious reopening. We're having very tight capacity restrictions. But in the retail setting, remember, there's many people going in and out, but not many people spending much time in close proximity to each other. We know in restaurants this is prolonged indoor contact. So we know that's adds to the risk. We know that from the literature and from data that we've seen super spreader events in restaurants for that nature. So this iteration, we're being very cautious. Like I said, we don't want to go backwards. We want to do a constant reopening and not have to go back and close things. So we're going to start very cautiously and then look at these other establishments as time goes on.
Second question, it wasn't stated in the bulletin, but what percentage of people were for or against travel restrictions being reimposed to the West?
You know, I don't know if I have that specific number. I do think that there was I can say that there is a majority of Manitobans supported travel restrictions when the epidemiology supported it. And so, but I don't have a specific number on that. Maybe we can probably provide some of those specific numbers.
And finally, a UK study has shown about 35% readmission rates for COVID patients. Have you seen high rates in Manitoba?
You know, so certainly we haven't seen, any that I'm aware of reinfection. Now, so readmission rates, I don't have any data on that. We can look at that and see, what those readmission rates would be like here. I can speak to reinfections, and we certainly haven't seen that in Manitoba.
Questions from Gavin of CBC Radio Canada. Canada will not receive any Pfizer vaccine next week. What effect will that have on vaccinations here in Manitoba?
Yeah, so the Vaccine Implementation Task Force has, very, solid plans and ability to adjust the plans based on the amount of vaccine that's available. So they are running through their numbers right now, and we'll have an update. Dr. Reimer will be out tomorrow to further update that, but it's because of the meticulous planning that task force has done that they're able to respond to changes such as this.
Second question, can you tell us how many home care residents have been vaccinated in the province?
No, I don't have that information. We can, bring that forth when the vaccine task force is out tomorrow.
And a final question from CBC Radio Canada. Is there a concern that the loosening of restrictions could be a sort of a signal for people who wish to have larger gatherings and lead to less obedience of healthcare orders?
So there is, there's always a concern. We're concerned about the numbers going up. We're concerned about ever having to close things again. So that's why we're taking a very cautious approach. We're being very clear that we're not out of the woods. We're always committed to using the least restrictive means to meet our goals. And we're opening up things in a very limited way. And a lot of this is going to depend on Manitobans' actions. If we start seeing transmission of that virus again, we're not going to be able to further reopen. And so this is really about how Manitobans are going to, hear our advice, because no matter what restrictions we have in place, it really comes down to Manitobans adhering to our public health messaging. So we are concerned, but we think with this very cautious reopening, we think with everything that Manitobans have learned in this second wave, we're going to be able to do this successfully.
Next, questions from Bart of CBC Manitoba. Why propose so many reopenings when pandemic indicators are so high?
Well, I don't think that this is so many openings. I think this is a very cautious reopening. We have retail that's been able to open right now at 25% capacity, and that with that 250 cap for the very large places. And so we're not changing that. We're just simply removing the essential items list. Household gatherings. This really is two additional people to your household. This is to try to achieve some of that, the connection that people need, that we've heard people need, but really limiting that number. And so we think this isn't, this is a very cautious approach, and then we'll follow it very closely.
Second question, what makes you confident that these are safe moves given 279 people remain in hospital?
Yeah, so this is very, very cautious. We think that in retail, wherever people gather, whatever interactions you have, you increase the risk. We feel that in the retail setting, where that risk is very transient, we have people indoors but passing by relatively short periods of time with very strict capacity limits. We think this is a very cautious approach. And same thing with household gatherings. We've had, many weeks of really no social gatherings outside your household. So Manitobans who have been following that have not had a chance to see in person family or friends. So we think that at this point we can have that cautious reopening of 2 individuals. So, certainly we still have a strain on the healthcare system, but that healthcare system has now been able to get back to some of the elective procedures, and our numbers are trending in the right direction. So we think this is a very cautious, very prudent approach at this point.
The third question again relates to the supply of Pfizer immunizations. Could you go over one more time what Manitoba's plan will be as the supplies dry up?
So as you know, our task force has very detailed plans on how to roll out the vaccine. It's a very cautious approach. We didn't empty our freezers. We ensured we'd always be able to keep up with the appointments that we had on hand. We've always planned to be able to give that second dose on time, although we weren't holding back the second dose. And so we'll have to see the details. The vaccine task force is running through the numbers right now. Of course, when you get a dramatic reduction in supply in a very short notice, it's going to have an effect on your program. Just that our program has very well thought out metrics to be able to respond to this, to be able to figure out how we're going to deliver the vaccine to Manitobans despite an abrupt shortage, and then again ramp things up as soon as that supply starts flowing again.
For those of you who have just joined us, we are having telephone difficulties today, so we will be relaying the reporter's questions to the doctor. From the Canadian Press, Steve asks, I gather gyms and organized recreational sports are not on the list. Can you tell us why? Is it because of the likelihood of prolonged indoor contact?
Yes, and that's, again, the prolonged indoor contact, and then evidence from, transmission from our jurisdiction, as well as, in the literature, as we've seen super spreader events in these. We've seen transmission at both youth and adult recreation events. So it does bring with it a higher risk. And so right now, due to the cautious approach, we're just going to start with the things we've outlined here, or, are still waiting for some more feedback, but what we've outlined today is what we're considering, and those gyms, restaurants, organized recreation will be continued to be reviewed for further iterations.
How above normal capacity is the intensive care unit system right now?
So for ICU, they typically have in pre-COVID 72 beds, and so we have 113 currently admitted in ICU. If we look at those numbers, 25 of them are COVID patients that are active, 12 are COVID recovered patients, for a total of 37, and we have 15 of those COVID active patients are ventilated, and 10 of the COVID recovered patients are ventilated, so a total of 25 ventilated clients.
And Steve's final follow-up question, when will a final decision on the proposals be made, and will they take effect Saturday morning?
So that's the plan. These orders expire midnight on Friday, so we are looking to have this new iteration take effect at 12:01. And the plan is on Thursday to be able to signal more definitively what those plans will be.
From CTV Winnipeg, Michelle asks, one moment please. Do the two people for household visits need to be designated, or is it just any two people at a time?
Right, so this is, they don't need to be designated, and it's a two-person limit at any one time. So again, our messaging is that this is not the invitation to dramatically increase our household contacts. So we want Manitobans to be able to have that connection. But we all have to realize the more connections we have, the more risk of transmission of this virus. So we know that it's quite difficult to, or impossible to enforce. If somebody had to actually designate two people, how we would ever enforce that is hard to imagine. But we want that messaging to be clear, that these are close family members, close friends that you need that connection with. But we still want to limit that the amount of contacts we have. It's now open to outdoor gatherings, group sizes of 5, which are even safer. We want Manitobans to be staying home if they're ill. And physical distancing and use of masks is also recommended.
What about personal services like nail salons, tattoo parlors? Why not include those at the 25% capacity limit?
So this goes again to our cautious approach. So we can't open everything at once. If we open everything at once, we risk seeing those numbers climb and we're stuck going backwards again. So we want to do things very cautiously, and so when we open things, there's going to be people who fall on one side and not the other, and so we look at things like the risk involved. We look at things like how essential it is to many more Manitobans, and so this is where we're heading to right now. And just knowing that we have to have that cautious approach, we just can't be back to where we were in October and November. And like I said, in October and November, these establishments were doing their best. They had protocols in place. And, right now I'm sure that they, feel that they're safe to return. But we saw what happened in October and November. Despite the best efforts of all these establishments, we're still seeing a tremendous amount of viral transmission, putting our healthcare system at risk. So we have to be very cautious.
Michelle's final question, why not open up any activities for families with children who are still at home?
Well, I guess it depends on what you mean by any activities. Outdoor activities are permitted at group sizes of 5. We're not having organized sporting or recreation activities right now, and again, it's because we're taking a cautious approach. We did see transmission in those type of events, and so we're going to open very cautiously so we don't have to go back again. So right now, there's lots of reasons to be out. Group size of 5. Now, group size of 5 apply to people's yards. And so there are ways to gather outdoors, and there's ways to stay active outdoors. So, and further things we'll be reviewing in future iterations.
Our next reporter's questions come from Stephanie at City News. Could you go one more time over the two-person rule, same two people at all the time, or any two people?
That's right. So, like the order itself, and again, remember, these are considerations. We haven't made anything final, so we're still going to hear some feedback. So right now, the proposal we're putting out is that it's maximum of 2 people in addition to the household members at any time. So we're not requiring a household to document or list 2 people, and that would be the only 2 people that would be over. But again, our recommendation is you have to limit this. The more we connect that way, the more contacts we have, the more risk of transmission there is, and then the less likely we'll be able to further our goals, further reopen things. So it's 2 people max at any time, not the same 2 people. But again, the wider you cast that net, the more likely that virus will be transmitting.
Just to follow up on that, Doctor, can you provide a list of businesses that would not reopen under the proposed changes?
Well, I mean, I think it's, from there, I don't want to try to single out any business. We've listed the ones that will open. The ones that won't, then that's the ones that will remain closed. So right now, it's retail will be able to continue to be open and also not be limited by the essential items list. They'd have strict capacity. As far as personal services, that would only include hair salons and barbers. And then as well as allied health professionals. So all other businesses are unchanged.
And the final question from City News. We saw the highest number of tickets handed out last week since early December. What do you make of this? Do you attribute it to any particular thing?
It's hard to know what to attribute that to. Certainly enforcement has to be at least part of the plan. But I think it's really clear that enforcement can't be, the major part of the plan. We need Manitobans to buy into this. That's one of the reasons why we're interested in the EngageMB.ca surveys. We want to hear what Manitobans have. We're certainly going to be guided by the science. But when we rely on Manitobans to adhere to these public health orders, to buy into them, we're really interested in what they have to say. Enforcement has to play that role. So we all know there's however you want to frame it, COVID fatigue. We've been dealing with this pandemic now over a year. We've had very tight restrictions on in Manitoba now for a couple months. So it's really challenging. But the alternative is something we can't allow. Right? We can't allow our healthcare system to be overrun. We saw that these very strict restrictions, very difficult restrictions, ended up saving a significant proportion of lives. So, we just can't deal with the alternative to not being cautious. But in saying that, we know how difficult this is, and we want to move forward, but we have to do it cautiously.
A reminder to our audience, our telephone line to bring in reporter questions is out of service today, so we are relaying the questions to our Chief Provincial Public Health Officer. Next, from CHVN Taylor, her first question, there are no changes to faith-based in-person gatherings. Can you share why?
So again, this isn't a reflection on the importance of those events or how essential they are to many Manitobans. This is a reflection on the nature of this virus, right? Prolonged indoor contact is where this virus spreads. And so we're at an important stage right now in our second wave, where we're seeing the transmission declining. We're seeing our numbers improve. And we're at a position where we can actually loosen some of our restrictions. But we have to do so cautiously. The more that we have gatherings, indoor, prolonged, the more transmission there will be. And again, like I said, it's not a knock on any businesses or organizations, right? All these businesses and organizations were doing their best. They had great protocols in place in October and November. But despite that, we saw that dramatic increase in our trajectory. We saw that large impact on our healthcare system. We saw our modeling numbers. So we just know that despite everyone's best efforts, the more we gather, the more interactions we have, we're going to see that virus being transmitted. So we have to do this opening very cautiously, or we risk having to go backwards again.
Do you have any words of encouragement for faith leaders or people of faith who were hoping for changes today?
I think that's, I think we should be hopeful here in Manitoba. All of our efforts have put this transmission trajectory in a place where we're now looking this week to loosen some of our restrictions. We have vaccine going into Manitobans' arms. So there's lots of reasons to be hopeful. We know that all pandemics have an end, and so we will see an end to this. We're going to take this cautious approach, and I think that even with the ability to loosen some of these restrictions right now, this approach is going to disappoint a lot of Manitobans. But like I said, the alternative is something we can't accept. Right? We just can't be in a position where we've overrun our healthcare system, where the healthcare system isn't there for all Manitobans, and we've already lost too many Manitobans. We can't afford to continue the trajectory we had in October and November. So I know that there'll be some that are disappointed with this. I think there'll be, some from our survey that think that we shouldn't be loosening at all. But we think that this is a prudent approach, very cautious approach, and we'll continue to loosen things as long as our numbers allow us to.
And Taylor's final question, how long will these potential new orders last?
We're thinking right now 3 weeks. We want to have that full incubation period in there, but we also want to acknowledge that we're going very slowly. We're a very cautious approach so that we feel that we don't need to wait those 2 incubation periods necessarily before we review. We're doing so very cautiously, so we feel that at 3 weeks we'll be able to be in a good position to decide on whether we're ready to loosen some further restrictions.
Up next from the Winnipeg Free Press, questions from Danielle. Do you think the Code Red was successful, and why did it last longer than initially was described in November?
Well, I don't think there can be any doubt that it had a significant benefit on our COVID numbers. So we were at that trajectory to see 1,000 cases a day in early December. And at that level, we were set to overrun our healthcare system mid-December. And so we went from that trajectory to now where we're seeing numbers consistently under 150. We're seeing some of those numbers, a proportion of those numbers, being localized outbreaks. And so there's no doubt that the restrictions have an effect. And so it's like I said, we know how this virus is transmitted. We know all about this virus. And when we see outbreaks occur, it's usually when the precautions weren't taken. And as we loosen things up, we can see that there'll be some risk to increasing numbers, and that's why we have to do it so very cautiously. But you can see in our jurisdiction, you can see in jurisdictions around us, the restrictions, while very difficult, while having many effects, they absolutely work.
Can you please describe the data and rates of transmission that supports the province's prioritization of social gathering expansions, reduction of retail restrictions, and some personal services?
Yeah, and so, a lot of our data, is some of it comes from our numbers. A lot of it just comes from the literature and many studies out there. And like I said, we know about this virus. We know where it's transmitted. We know how it's transmitted, right? In closed spaces, prolonged contact, crowded places. This is where this virus is transmitted. So there's nothing surprising to us anymore about how this virus is transmitted. And so when you look at the loosening restrictions we have right now, they're not including places that really have the prolonged enclosed contact. The possible exception of that are our residences, but we're limiting that to very low numbers and messaging that we need to limit that. But we know how important it is. We know the effects of isolation can be on people, so we wanted to have that ability to somewhat offset that by having those two additional people come to the household. But I think that's still very limited. So when we talk about retail, there's people gathering there, but it's not prolonged contact between individuals. So we feel that with those tight restrictions. It's a very prudent response, and we'll continue to follow things over time to see if we can loosen up.
And Danielle's final question. Why should Manitobans feel confident that reopening, though few sectors are being considered at this time, can be done safely, given our experience with exponential growth in the fall?
Well, I think it's important to message that, and that's why we're doing this very cautiously. And so, there's a lot of questions here, and I'm sure there'll be a lot of Manitobans question, why didn't we open more, or why didn't we open this and that? And it's for that reason. We've been here before, right? We've been here with good numbers, and very quickly they turn to bad numbers. And all of that is predictable. It's the increasing gathering, increasing connections are going to spread the virus. So we have to do this very cautiously, and I think the confidence comes from the fact that these restrictions, with the tremendous help from Manitobans, have brought our numbers down to a place where we can begin to loosen things. But this is a very cautious approach.
Our next set of questions comes from Joe at Global News. The City of Winnipeg has been operating its in-house gyms exclusively for employees during the level red. The city says it got permission to do so from the province. Can you confirm the city was given permission, and why?
So we weren't given, specific permission. Our public health orders don't apply to any levels of government. So they don't apply to federal, provincial, or municipal governments. So, so I am aware of health inspectors had visited some of these gyms and found them safe. But the real issue, they weren't given an exemption outside of the order. The order itself doesn't apply to governments.
Second question, so why can't small apartments or condo or family gyms operate following the same guidelines used by the city?
Well, this is the same thing about how quickly we open things up, right? It always comes down to this. So we expect governments to be able to regulate, and so we're not going to tell governments how they function. And so if they feel that they could have a limited capacity and run these gyms for their employees for certain reasons, then we're not regulating that. When we open it up to the public, then it becomes many more Manitobans involved in it, many more centers. And so it's, again, we're getting back to where we were in October and November. We constantly hear from Manitobans, from businesses about how safe their operation is. And I certainly don't doubt their efforts and the protocols they have. It's just that, where were we in October and November? Everyone was doing their best. Everyone was committed. But despite that, we saw that dramatic climb in our numbers. And so we're doing this cautiously. This here is a specific situation, but our orders right from the very first public health order we wrote does not apply to governments.
And 1 second, please. Joe's final question. Will all reopening phases run in 3-week increments?
Well, we can't predict, really what each one will look like. I think that certainly the plan is to write these orders for 3 weeks and have a review at some point. That doesn't mean that they, can't be extended. It doesn't mean that there can't be a review of certain things earlier. But I think for the most part, as we start this very cautious reopening, we're going to have these reviewed every 3 weeks.
And a reminder, once again, we are having some telephone issues, so we are asking the questions on behalf of the reporters. And up next from the Brandon Sun, Colin's first question. Commenters on our social media pages talked about seeing people without vaccine appointments getting in line at the Keystone Center in Brandon at their super site and asking to be vaccinated. If this is correct, how did this affect operations at the super site?
Yeah, I don't have details on this. Let's ask Dr. Reimer that tomorrow.
His second question, the release sent out this morning mentioned a high percentage of survey respondents asking for a regional approach to restrictions. How likely is it on Friday that we'll see a regional approach to the new health orders and restrictions?
Well, I think it's very likely that we're going to see that regional approach where this loosening of restrictions is unlikely to include the Northern Health region, just because of the current trajectory that they have. So we will start to see the beginnings of that regional approach. And in moving forward, again, we're going to follow those numbers. Remembering that in the early parts of the second wave, we took that incremental approach. We took the regional approach. We took a very incremental approach at restrictions. We relied on messaging for as long as we could. But we saw ourselves in a very bad situation in November. So we'll have to be cautious, but we just can't open things up quite quickly because we'll be looking at closing them down again.
And the final question from the Brandon Sun, is the province considering changing rules for venues or event spaces for Friday's renewal of health orders?
That's not in consideration right now.
All right, and our last set of questions comes from Cameron McIntosh of CBC National News. Minor hockey leagues are pushing for a chance to resume play to salvage the season. Do you see any organized indoor sports coming back before spring?
Yeah, I'm not going to speculate on where our numbers are going to be. Certainly we see a lot of benefit in those kind of activities. So as soon as we feel it's safe to get back to that, we're going to allow it. We're going to find a way to allow it. But right as of now, that's not in the plans for this iteration.
Thank you, Doctor. And this concludes our media briefing.
Thanks.